My name is Dr. Daniel Fahim. I'm a brain and spine surgeon with Michigan Head and Spine Institute. I want to talk with you a little bit about the cervical spine and some of the diseases that can affect our cervical spine. So the cervical spine, or our neck, contains 7 bones and discs between each of those bones. The bones at the top of the cervical spine are pretty unique in that they support our skull and help us be able to turn our head completely. Below that, what's called the subaxial cervical spine, the bones and the joints are all pretty similar to one another. So one of the diseases that's most common in the cervical spine is disc disease, a disc herniation in the cervical spine. And this model here shows the bones in white and the discs are kind of the spongy material in between. And sometimes as we get older, these discs degenerate and they can push back on the nerves. The nerves are coming down from the brain and they're exiting at each level, just behind the discs between each of the bones at each of these levels. And these are the nerves that go to our arms, and these are the nerves that provide sensation and movement of our arms. So a lot of times patients will feel burning or numbness or pain in their shoulders or in their arms or in their fingertips, sometimes coming from their neck all the way down their arm, and it can affect either arm. Or when it's allowed to progress substantially, they can also develop weakness in their arms or in their hands. And all of those things can certainly be addressed with surgical intervention to prevent continuous injury and damage to the nerves and the spinal cord. An even more severe type of disease that can affect the spine is something called cervical myelopathy, where the cervical spinal cord gets squeezed. And that can happen because of degenerative disease in the spine affecting the joints. And when that pressure is applied to the cervical spinal cord, that can cause weakness of the arms and legs, and it can affect all sorts of our neurological functions and our ability to walk, our ability to handle small objects with our hands, such as keys, coins, things like that. And we develop so-called cervical myelopathy. And that's actually a sign of the cervical spinal cord being damaged. So the two general ways that we address problems in the spine, the two general surgical strategies that we take are from the front or from the back. From the front, we perform discectomies, anterior cervical discectomy and fusion, which is done through a small incision in the neck in one of the folds of our skin, and it allows us to come down to the spine and remove the disc that's compressing the nerves and replace it with some sort of intervertebral body device to replace that disc, and do a small fusion at that level after removing the disc that's causing a problem. The other general way that we approach the spine is from the back of the spine, which allows us to address multiple levels at once by removing the pressure off of the spinal cord by removing some of these bones and taking the pressure off of the spinal cord. And sometimes that's accompanied by a fusion to help stabilize the spine, depending on the individual patient's problem and circumstances.